welcome to our show today. As you can see, I have this magazine, Dermoscope, and we're going to be talking about all the different things that you can do to help your skin and your face in particular, and your hands. If you have any kind of marks, growths, or anything else on them, we're going to be talking about how you can rid yourself of them. So I have an expert here today. Actually, Stephanie Holvick is here, and she has rnfaces.com. And I have met her before. As a matter of fact, I had a little something on my eyelid for years, and every doctor I went to said they'd have to take all my eyelashes off in order to remove it. So I was scared to death of it. But Stephanie took care of it immediately with just zapping it with something. So I think she's fabulous, and we have many different things we're going to show you here today about the things that she can do. So she's a very interesting person, and she has the Skin Classic to treat various minor skin irregularities in one treatment, like skin tags if you have them, milia, the little white spots, and other things. And I'm going to let her explain that to you, but I'm going to introduce you to our other guests first of all. We have, who do we have here? Paula. Paula is a UN nurse, or was a UN nurse. She's redirected at the moment, but Paula has done this Yoga Pilates DVD, which we've had on the show before, and she's very, very good at that. She's going to have something done on her hands, so you'll see that. And then we'll have Penny Chelios. You probably recognize the last name and the picture of her brother on here, because her brother is a famous hockey player, and she's famous for what she does because she too is a miracle worker. She does a special kind of massage called cirripulation, and I'll let her explain for a minute what that is when we introduce her. And then we have Gloria Holland, who's been here with us to co-host things. She's our consumer advocate. She asks a lot of questions that you're going to want the answers to. And then we have Stephanie Holvick. And so Stephanie's going to tell us through pictures what some of the things she does, and then we're going to utilize our models to show you different things. So welcome, everybody. Thank you.
Thank you.
So I'm going to let you each give your name so they can see you on camera so they know who you are. So let's start with you, Paula Woodley.
Okay. My name is Paula Woodley.
I'm Penny Chelios.
Gloria Holland.
I'm Stephanie Holvick.
And we have Nicole, who is our model, and she's an esthetician as well. So Stephanie, I'm going to let you start because you are just full of information, I know that, and talent. So can you tell us what some of the things are that you do?
Sure. First of all, our machine, the Skin Classic, is direct high frequency. And when you refer to something being zapped, we sometimes think of the dermatologist, where they do zap things and spark, and you might smell flesh when they treat you. So this is something different. This is electrodesiccation, which electrodesiccation dehydrates the skin. So these minor skin irregularities that are located in the epidermis are easily treated with electrodesiccation versus cautery. So that's the big difference. There really is no zapping. It's silent, as you remember, and it dehydrates rather than burning or charring, which there's nothing wrong with that, but in the cosmetic world that we live in, we like to use things that are less caustic on the skin. However, everything that we do treat does get a little crust. And I have a few examples of what our machine does treat. So we do have a list of them, but the visuals here really speak for themselves. We have clients that have a lot of broken capillaries or telangiectasia, and this is actually a little case of before. Immediately after, it looks like they're gone because they're dehydrated, and as they're dehydrated under the skin, they become a little darker looking during the healing time, and that's why as I treat you gals today, over the next few days, you'll notice that what we treat does get a little darker. Over here, we have something super interesting. So I like to call them Morgan Freeman spots. I think we can all relate to something like that. This nice lady, you probably know some African Americans, perhaps Indians, islanders that have these little dark spots. A lot of times people call them moles. They're not moles, it's actually called DPN, dermatosis papulosa nigra. Morgan Freeman spots for ease. So this was one treatment with a machine that took about 10 minutes to do. So she went from being very marked up to having a nice smooth complexion. So this nice gentleman, a little bit lower here, has what we call, for ease of words, barnacles, right? We all can relate to barnacles on the skin. Sometimes they look like somebody had flung mud at someone. They get a little sticky looking. Well, these are all keratosis, and it's a benign irregularity. So we can treat these with the Skin Classic Direct High Frequency, and that was his result after one treatment. Some of these photos come to me from our practitioners that have the Skin Classic, and if anybody out there is watching our website, you can also find a practitioner. We have hundreds of providers throughout the country, and that's how some of these clients actually got treatment. Went to the website and found a skincare provider. Here are some more barnacles that we have over here that will be treated in one treatment. However, some things may take a second treatment. It's super easy to work around the eyes, as we did you, Karen. It doesn't affect the hair, so it doesn't burn hair. You won't, again, smell the flesh burn. So it's easy to work in the eyelashes, in the hairline. Barbers like the results because many of the men that come in might have skin tags in the back of their head or cherry angiomas. Even our ladies and gentlemen that have spots on their hands get a great result with one treatment, and it's a super quick treatment as well.
Well, it just was curious why everybody else that I went to said they were going to have to take my eyelashes off in order to do this, and you didn't.
Well, because they don't use this type of equipment. It's more cosmetic. A lot of you might have went to an ophthalmologist, and they would typically inject with numbing cream and a numbing agent, and they might have to take some of the eyelashes out. But this only works in the epidermis, so we don't affect the hair. We can work in the hair without losing the hair. Like that nice gentleman on the table next to you, his dermatologist suggested he see an ophthalmologist, and he had 2 large skin tags right in the middle of his eyes. Took about 5 minutes to do, and his dermatologist was amazed.
And you know, I saw a dermatologist and an ophthalmologist before that. I mean, everybody was telling me how difficult it was going to be, and you well, you said it's not zapping.
But it's
You touched it.
Exactly.
And they say that it came from possibly using mascara that might have gotten older or something, that you have to be very careful with that because it can cause bacterial or something, and then you get a tiny white spot. You call it milia, right?
Right, right.
Okay. And that's also why I don't have any eye makeup on today. I want everyone to know that. It's like,
Because she wants a treatment.
that's right. So I guess we're going to start with Nicole, and you have a model here, and she's also an esthetician, and she's young, but she has a couple of things anyway. So
That's
it doesn't
right.
matter the age, right?
No, it doesn't matter the age, but of course, the older we are, the more irregularities that we'll gain over the years. And the minor skin irregularities that we do treat, well, Nicole has a few things. She has something called sebaceous hyperplasia, and that's probably one of the most sought after irregularities that people see us for. They can have skin tags treated almost anywhere, but sebaceous hyperplasia needs to be treated very carefully and not zapped with a cautery because it can leave a mark. So sebaceous hyperplasia is an oil gland disorder, and the oil just spreads under the skin, and it's not something that you can extract. So we have to be able to draw the oil out. Hers are small, so I'll go through and I'll show you what we're going to treat and show you how.
Stephanie, tell them
Quick
what your
treatment.
prior experience as a nurse is.
I am an old OR nurse by trade, and while working in the OR, I worked with plastic surgeons and kind of fell into my love of work. And so from there, I started doing permanent makeup to assist the blind with their look. They needed to have that self-esteem, and I was able to do a lot of permanent makeup for visually impaired and medically necessary, and also cancer survivors and things like
You
that.
still do that?
No.
No?
No, I am so busy with the Skin Classic, training other professionals around the country that, no, I don't do that, but I did also teach for many years permanent makeup. So working around the eye is very normal and natural for me. So it may not be for everybody, but for me it is. Okay, so this is the Skin Classic, And we use a sterile little probe. It's not sharp. And basically what I tell my clients when I'm working, all we're going to be doing is tapping and touching. So this is not a needle that will be inserted into the skin. There is no blood associated with these procedures. There is a light crust that will develop over the next few days, and that crust will be there for 5 to 7 to 10 days, and then maybe a little pinkness. But generally, that's it. So it's a very easy procedure. Earlier this evening, I mixed up some BLT from Neuromed BLT, and it's tetracaine, lidocaine, and benzocaine. And it's a 3 mixture that I did mix up, and I put a little numbing agent on the gals. It just takes the edge off. It's probably not totally numb, but it makes it comfortable, and it's a great numbing agent for other procedures as well, permanent makeup, microneedling, anything that you might do in a med spa.
Is there any danger to microneedling, having it done?
Actually, no. Not plain straight up microneedling. It's actually good for the skin, making those micro channels and being able to have your serums penetrate. And even without any serums penetrating, just the microneedling itself can stimulate the collagen and fibroblasts in it.
Go ahead.
In a nice.
We have a call-in show today. That's okay.
Yeah.
That's
Oh,
okay.
who's calling in? Yeah. Okay, so. That rattled me. So let's see here. We put a little numbing agent on, and so we looked over Nicole's skin today, and she has what's very hard to see on camera is a few sebaceous hyperplasias. So I'm going to go ahead and treat those. Let's see. Let me. You can step on that pedal for me. How about that?
This pedal here?
Yes, ma'am.
Okay.
Perfect.
You want me to stay stepping on it, or
Yeah,
just?
sure.
Okay.
Step on it.
Okay.
Step on it, sister.
Is it working?
Keep your foot on the outside
Okay.
edge. Nope.
No.
Push on it. Put your foot on the outside edge.
Hang on a second.
There you go. And just keep it there.
Okay.
Okay, so go ahead and close your eyes and let your brow relax. That lets us at least see this a little bit better. So that little area there, some people have many, many bumps. She's an esthetician by trade, so she really takes great care of her skin, and she's young. But if she didn't have this treated, she may develop more, too, throughout her career. So what we're going to do is just lightly, and you'll feel this a little bit. Maybe not that, you're not on it. Take the ball of your foot.
It's really stepping hard.
No, you're step
More?
on the front of
I'll
it, not the
stand.
back of it. Nope. Perfect. It's like
Is it on?
take your toe and bring it back. Like, there you go. Perfect. Okay. Ooh. Ah. So that probably tingled a little bit, but that was the oil gland that just kind of blossomed. So it's a little bit of oil that comes out of the skin. But we have clients that have like 60 of those on their face at one time, and so it's a little disfiguring for them, not for her so much. So let's see here. She had a little one right here. We have a little bit more robust treatments ahead. She doesn't have that much, but there's another tiny one.
So how did she get those?
It's an oil gland, an inverted oil gland. Sometimes people that have had acne as young people, which I don't think you had bad acne, did you?
No, I didn't.
But typically acne sufferers as they get older tend to have sebaceous hyperplasia instead of their acne. They have good oily skin, and that's what
So
happens.
it has nothing to do with the way you wash your face? or anything?
Absolutely not.
No?
So let's see here. A little tiny, she's got a few little skin tags. Let's do those. That might be a little. So we have a little witch hazel here.
Have you had those your whole life?
They have developed probably over the last, I'd say 6 years. They're, all of a sudden you notice that they weren't there before, and then they are there.
Overnight?
It almost appears as if
Yeah.
it's overnight. It definitely takes time for them to build, I would say. But you kind of notice it overnight, so to speak.
Mhm.
And they're not something that you can take care of on your own with your home care.
You can't squeeze them.
You can't
No.
squeeze them, nothing happens. You
No.
can't extract them in a traditional method. So it's kind of frustrating.
And our clients are the most happiest, these sebaceous hyperplasia clients. Here's a couple little skin tags. So we don't remove skin tags, we actually treat them. We just tap them, dehydrate it, that one is done. It's a super quick treatment.
Now that, I'm surprised that at her age that she has a skin tag. Is that another thing that's, I always think that's age related.
Not really.
No?
It could be friction related, pregnancy related. After gals are pregnant, sometimes they develop these little, what we call cherry angiomas, which I will walk around and treat on the other side.
I get them regularly. I've had them for
The cherry
years.
angiomas.
Yeah, I've had them, I have a couple on my legs. And I've had them my whole life. They just have always been there.
So the cherry angiomas are these little tiny, what we sometimes call ruby spots. And some people have tons of them, but these are very easily treated with just one touch. And this can take the place of a laser in a med spa. Okay. That's one anxious caller. A little tiny brown spot under the eye. And if we lift up, one more cherry angioma. And that's really all that I could see here. Let's tilt your head down and close your eyes. Yeah, I think. So she was pretty to begin with. She just had a couple flaws, not much at all. So she's our young one with not much, but we have others that have more. So let's see, one more little skin tag here. And another little, see, we can kind of find these little things. Now this is a mole here, and we don't treat moles. And one thing I'll show you that as a, you can let your foot off that pedal. We have a derm light. Every dermatologist in the country uses one of these, and we can actually look at a mole. We turn our light on, and we can visualize if anything, anything has a blood supply. And you can see how that mole does have a blood supply. So in our aesthetic world, we're not physicians, we're not permitted to treat anything with a blood supply other than an epidermal, capillary, or cherry angioma. So this is where we just excuse ourselves from our clients and say, I'm sorry, we can't treat that, even if they want it treated.
Exactly.
Does that make sense?
Absolutely.
Good deal.
Yeah.
And is that the reason because there's going to be bleeding afterwards, or?
Yes,
Yeah.
it could bleed. It's more medical. And if a mole is to change and become precancerous, we don't want to affect anything that could become precancerous. These sebaceous hyperplasias can't, a skin tag it can't.
Right.
So we only want to treat the minor skin irregularities that we see in our office on a daily basis under our lights.
So are they cauterized usually by dermatologists or
Sure.
excised?
Sure. They can cut the skin tags off, or the moles, they'll cut them out and stitch them to be permanently done. Sometimes they'll shave them down, but they have the ability to come back. Very nice.
Yeah. Thank you very much.
Comfort level was okay?
Comfort level was wonderful. I hardly felt any real sensation,
Good.
just a tiny bit, but I would not say it would be something that would deter me from having another service at all.
Okay, great. And she's young. It's usually, us old gals that are okay with things, but when they're this young, that's good.
Great testimonial.
Well, thank you, Nicole.
Thank you very
I
much.
know you have to leave, so
I do.
thank you very much.
Thank you for having me. It's great to meet all of you. Have a wonderful
You look
day.
beautiful, even
Hi,
better than when you got here.
And on your way out, get that phone and throw it in the trash.
It's gone. So Stephanie can sit on it if you want to sit somewhere, but what are you going to do next?
Well, let's see. I think what I can do, I just want to wipe this off very quickly. Get rid of this. Would you like to have those spots on your hands done?
would.
You put them on the table and show the camera what we have. Be happy to. So our hands can give our age away. You can see how lovely her skin is on her face. She doesn't have much aging going on. There's no brown, there's no keratosis. She looks very homogeneous. But when we get down to the hand, occasionally that can stop. You know, we look at it and we're like, uh-oh. So she's only got a few, and if you just make more of a fist on the table like that, then you can actually see the brown in the skin. So this does treat flat hyperpigmentation. It's got to be brown. And let me just get my gloves on here.
Is it melatonin? I mean, they say that that's in your system. I mean, why does this surface all of a sudden as we get older?
Okay, the melanocytes are down in the dermis. And so with the melanocytes, what will happen is they will start to percolate up through the skin. So the brown that you're seeing is really epidermal and not dermal. So that's why our machine will take care of it. We'll kind of lift it. It will get darker brown. It won't get any bigger. It will stay the same size because you see how precise our probe is, right? Okay, so what I'll do...
That doesn't come from getting too much sun, though, does it?
Yes, it does. Everything that we do really comes from too much sun. It's the aging process. But to be very honest, her hands look really terrific, don't they? So, but a couple of those spots really need to be gone to have that flawless look. And then your esthetician that you see would be able to treat them from time to time if they decide that they need to.
And I have some of those too.
You do?
So they just pop up.
Yes, they do.
Even though I'm try to put sunscreen on my hands diligently, it's just an accumulation over years.
Accumulation from when you were a kid, really, you know, not so much what we're doing now because we're also very careful. So the probes that we use are one-time use disposable, stainless steel, so they won't affect if there's no nickel in them. And I'll just change this very quickly.
How long have you been doing this?
I've been doing this procedure since 2007.
Quite a while.
Yeah, quite a while. And it's nice because I've really built up a nice provider list. So if anybody's out there and they need treatment, this is
So they go to rnfaces.com?
They can go to rnfaces.com, find a provider, and they've all been certified and trained.
And the providers can go there to find you to become providers.
Correct, yes. So, let's see here. So we have this nice brown spot, and we had already numbed it a little earlier, so it probably should be comfortable. Let's put that right there. Perfect. So what I'll do is just moisten this a little bit, and I'm going to tap, 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 tap. Seem to be okay?
It's okay.
Good. I think it's a stingle.
Do you feel anything?
A little burn.
Little
yeah.
burn.
Right, and that's done.
Yay.
So if somebody has a lot of brown spots on their hands, we can take care of them very quickly. And then let's see this one.
So tomorrow her spots will turn white?
No, they'll be a little darker
Okay.
as the pigment lifts.
And they'll get crusty.
A little crusty.
But don't pick at them.
Don't pick, and we just want you to wash gently, pat dry, and use a good moisturizer. Good, healthy skin heals very quickly. And then this other one.
So now wherever you go, lead with your hands.
This one wasn't totally a big spot. It was just a couple little spots, and that'll take the edge off of making it look that way. So tomorrow you can expect them to look a little darker.
Okay.
And unlike the face that heals in 5 to 7, this might be 10 days before the crust comes off. Just baby it, wash gentle with fingertips, pat dry, and a good moisturizing sunblock. Always. Our hands need that sunblock too.
Thank you.
Okay,
that easy.
Stephanie, we're going to do another show with you because we have two other models with different things. So
Okay.
we have about 4 minutes left, and I'd like to give you the time to say whatever you would like people to know that they don't already know about their skin.
Oh, about their skin. Okay, so minor skin irregularities can start early on in life, and they accumulate more and more as we get older. So, for instance, like the nice lady in the middle of the paper right here, with DPN, many family members have these things, so they will accumulate. And if they get to a practitioner like us, they can have these treated and maintain a clear complexion for years. Same way with broken capillaries. People may be allergy sufferers, and this is one treatment. So it's important to get these treated quickly, but it's also important to have a practitioner who knows minor skin irregularities and doesn't overstep their bounds or scope of practice. We don't want to be junior dermatologists. That's for the dermatologists. They're the ones that will diagnose. We're looking at things that we see every day on our treatment table as skincare professionals. We look at skin tags, and so when somebody has a piece of equipment like this, they can really set their clients' standards very high because their self-esteem is built up. When their irregularities are gone, then they can move on to those procedures like you talked about, microneedling. It's very important to have a clear canvas before you move on to other
Does that machine
procedures.
do any of that, or no? This is
No, this is
specifically?
strictly just
Okay.
for the minor skin irregularities. There really is no other tool, but then afterwards the clients are anxious to take it to the next level.
Can you look at your camera? I want them to see how beautiful your skin is.
Why, thank you, thank
And
you.
tell them how they can contact you, because we're down to about 2 minutes now.
Okay, so if anybody is interested in the Skin Classic as a to find a provider, go to rnfaces.com. We have a provider page. If you are interested in becoming a provider, we provide one-on-one training in your facility. So when you purchase a machine from us, it's under $5,000. You will actually get a skincare professional come to your office, sit down side by side, and teach you how to use this machine effectively and safely.
Thank you, Stephanie Holvick. And thank you, Paula Woodley, Penny Chelios, Gloria Holland. Thank you for joining us. And thank all of you for joining us, because I hope that you've learned something with this. We're going to be doing a follow-up show because we have some other diagnostic things that have been found on our other models that you might be interested in seeing, or maybe you can compare with things that you have. So I'm Karon Gibson. Thank you for joining us. You can email me at asktvnurse@yahoo.com. And can they email you?
Sure, absolutely. Stephanie@rnfaces.com.
And that's rnfaces.com. Okay, thank you for joining us, and we'll see you next time.